He earned his medical degree from the University of London before moving here to the States. He went on to complete a fellowship in hematology and oncology at Memorial Sloan Kettering Cancer Center in New York, where he served as the chief fellow. He does a lot of research, and in fact, he is the primary investigator in a number of national trials going on. So who better to talk to us about the latest breakthroughs in research right now than Dr. Danso.
Well, thank you very much for that very kind invitation to speak. I'd like to thank the organizers for this event. It's a very special event, and it's nice to see so many familiar faces in the audience. I think this is, what, the 4th year we're doing this now, and it seems to get larger every time. We might need a larger room next time. But anyway, so thank you very much for organizing this event. So I have 8 minutes to talk, so I better get going. So as we all know, breast cancer incidence is about a little shy of about 200,000 new cases in the United States. And we're actually seeing a decline in the death rate from breast cancer for many reasons. We'll continue to be about 40,000 deaths a year in the United States, but we are seeing a decline mainly because of better screening and we hope better treatments as well. We also, over the several years, and certainly over the last decade, have a better understanding of breast cancer. We have a better understanding of the molecular biology of breast cancer. We know that breast cancer is not one disease. It's a slew of diseases, and there are multiple subtypes of breast cancer. And a lot of the research that's going on now is research into defining the subtypes and then finding therapies that will treat those subtypes. The most important subtypes is, it's a very educated audience, so I know you know a lot of this, but the most important subtypes, as we all know, are estrogen receptor positive breast cancer, HER2 positive breast cancer, and the so-called triple negative breast cancers. Woo, woo, woo. So basic science research is really leading the field in trying to determine in estrogen receptor positive breast cancers, what are the signals that make these cancers eventually refractory to anti-estrogen therapy. There's also a lot of basic science in HER2 biology, trying to find different targets that will bypass Herceptin refractory HER2 breast cancer. There's a similar explosion in research in the biology of the so-called triple negative breast cancer. We know a lot more about this disease biologically, and recent research anyway has identified a new target called PARP, which is an important target in patients with triple negative breast cancer. So what's new in metastatic breast cancer research? Well, as we all know, metastatic breast cancer is not a curable disease. It's a very treatable disease, and many patients live many, many years with metastatic breast cancer. This occurs when the tumor spreads from the breast or local lymph nodes to other parts of the body, like lung, liver, bone, and it's essentially a disease that a woman will live with for the rest of her life. And we're doing a much better job at controlling metastatic breast cancer. But the goals of care for metastatic breast cancer are: 1, to prolong life; 2, to improve quality of life, improve symptoms from the disease, and also, very importantly, to minimize the toxicities of our treatments. So, moving on to this year's ASCO. So what was new in metastatic breast cancer research at this year's ASCO? ASCO is the American Society of Clinical Oncology, and we as oncologists go to this meeting every year. We try and participate in the research and then go and find out what other researchers have been doing. So and a lot of times, a lot of the news is actually comes through the business pages, because various investors are quite keen on finding out what is the latest and newest in breast cancer as well. So you learn about as much about ASCO reading the Wall Street Journal as you do with our regular journals too. But anyway, so VEGF is vascular endothelial growth factor. It's an important receptor for for blood vessel growth in breast cancer. So it was an update of a series of trials looking at bevacizumab or Avastin in metastatic breast cancer, at least 3 or 4 trials that were updated with something called a meta-analysis to look to see, amongst all these trials, what is the true benefit of adding Avastin or bevacizumab to standard chemotherapy. And from these series of trials called Ribbon 1, Ribbon 2, Avado, and another trial, to clearly demonstrate that the addition of Avastin to standard chemotherapy significantly improves the response rate for patients with metastatic breast cancer, and also improves the progression-free survival, the time to which the cancer grows. And I'm proud to say that VOA, locally, we were involved in that trial. Many patients in VOA were involved in that trial, and all the hard work here certainly contributed to these various trials being a positive trial for the breast cancer community at large. Now, there are other targets for VEGF, other medications for VEGF. One of them is called sunitinib, and sunitinib is essentially a tablet form of Avastin. It does the same things as Avastin, but it's a tablet form. So the hope was that using this tablet form of Avastin would be as good as using Avastin in metastatic breast cancer. So there's a large series of trials with over 2,000 women. Was again presented at ASCO, and the hope was that this new drug would show similar efficacy as Avastin. Unfortunately, sunitinib was not shown to be as effective as Avastin. So that was one where the research was critical because it could have been a very useful drug, but it shows that we still have a long ways to go. And the sunitinib trials presented at ASCO were actually negative trials. The addition of Avastin, of sunitinib to standard chemotherapy did not improve progression-free survival or response rate. An important trial, though, that was presented was of a new drug, a new class of drug, a drug called eribulin mesylate. And at this year's ASCO, there was a large trial done with patients who had had multiple therapies for metastatic breast cancer. So it had at least 2 and up to 5 therapies for metastatic breast cancer. Were randomized to this new drug called eribulin, which is derived from a sponge in the Pacific Ocean. And it was a randomized trial. Half the patients got eribulin, and half the patients got whatever chemotherapy the oncologist chose for 2nd, 3rd, 4th, 5th line treatment of breast cancer. So it was a very broad trial. And the results were very encouraging. Eribulin, which is a very new drug, was shown to be actually superior to physicians' choice of chemotherapy in terms of response rates and overall survival. It's very hard to prove an overall survival benefit in metastatic breast cancer trials, and in this trial, an overall survival benefit was shown. Again, proud to say that VOA was involved in those trials. We've had eribulin available here for many years, and we had at least a handful of patients that were involved in this trial, and again, a positive trial where the Hampton Roads community has contributed to breast cancer research at large. So, moving on to specific subtypes of breast cancer. So for HER2 positive disease, early data clearly shows that we know that Herceptin is approved for the use of used in combination with